So surgical planning, right? I think that the important point I want to make here is that even if you've gotten over your stone episode, you should not be waiting, or you've passed the stone, but you have 6 more in your kidney, and you got to talk about what surgeries to do with your doctor. You should start thinking about medical planning at the exact same time. Right away, you should be thinking about what I can do next to prevent more stones from forming at the same time that you're ready to get working on getting this plan to get these stones out of you. Because if you have a plan and you get them out, but you don't do anything to prevent them, you're just going to have another set that you have to go get out again, and that's no fun. So definitely planning medically at the same time as surgical planning is really important, and make sure you hammer that out with your urologist. But in terms of stones, I mean, I don't want to get into too much here. I just kind of put this here to realize that your kidney is kind of, your kidney's lots of different angles to it and different parts. And so some stones get stuck in some areas more than others. And it makes it a little bit tricky for surgery at sometimes. So, I think that, the goal really is to try to get to a place where you don't have more stones. Because if you have a stone in the lower portion of your kidney, it's harder to get than the upper portion of your kidney. It's harder to go down and sort of go against gravity to go down in there and grab it. So it's just a difficult thing that you need to plan it, and we got to try to do things to keep it from going back to the operating room. All right, let's see some more questions come in. Is there anything that you can dissolve cystine stones with once they've formed? Unfortunately not. There's never been any medications that have been proven to do that. Are any surgical procedures safer in the long run? So we could talk a little bit about surgeries here. Sorry, let me hit that forward. Ultimately, you should not be having ESWL. So this patient specifically referred to ESWL. ESWOL or ESWL stands for extracorporeal shock wave lithotripsy. It's when you go and they have the big ball or the water ball pushed up next to you. They don't do any procedure on you, no going up with a scope. They just kind of put you under the X-ray machine and use the ultrasound machine to break up the stone. 75+% of the time that will fail for cystinuria. So if your surgeon wants to do that, you should think twice about going forward with an ESWL. Safety-wise, it's pretty safe, but so are lithotripsies, meaning the ones where they go into your bladder and up into your kidney. And so that's a much more effective procedure. If you had a different type of kidney stone, I might give you different advice, but specifically for cysternurics, ESWL does not work very well. And so you need to have a laser done, or you're going to need to have what's called a PCNL when they go in through your back and directly into your kidney to get the stones out. Question asked, how often should you get your kidneys cleaned out? The answer I'm going to give you is hopefully you get it cleaned out one time and all the stones that seem to be a problem. And then once you are taking the right steps that we're going to talk about in the next section to help prevent stones from forming, that you don't have to go back to the operating room again. So let's hope that that's the plan. So there should not be a certain amount of time or how frequently you should go back to the operating room. It should be get yourself with your surgeon to the point where you guys decided that it's the right thing, that your kidneys look good and there's no growing stones, and then try to prevent all the stones from coming so that you don't have to go back to the operating room again.